Wildland fire frequency, severity, and duration are increasing throughout the western United States and around the world. While 80% of wildland fires are accidental, they are exacerbated by climate change, and their effects on community health, the environment, and wildlife is substantial. Identifying where resources and personnel need to be sent within the affected areas to help the local population is a core part of the disaster response and relief effort. To address this need, HSR.health has developed, through the support of the Open Geospatial Consortium's 2023 Disasters Pilot and pilot sponsors NASA and USGS, our Wildland Fire Health Risk Index, which has been tailored for the western United States. Wildland fires affect vulnerable populations and contribute to negative health impacts through the flames, smoke, and damage to infrastructure. The primary health effects include impacts to cardiovascular health, respiratory health, mental health, direct fire-related injury, including burns and heat stroke, and increased susceptibility to respiratory diseases, including COVID-19. The Wildland Fire Health Risk Index identifies a priori the health and medical needs of the impacted population and informs emergency response personnel, public health officials, governments, economic development, city and civic planners, and global public health organizations the information that they need to take preventative measures before a wildland fire occurs to limit its impact, speed response efforts during a disaster scenario, and guide recovery efforts in the aftermath of a fire. Shown here is a dashboard built in the ArcGIS Online environment of the Wildland Fire Health Risk Index for the western United States, overlaid with historic and current wildland fire extents that indicates the regions of relatively higher health impacts from wildland fires and where resources may be more at need. The underlying health and social data of the population is included in the dashboard and associated layer, a subset of which is shown in the highlighted table. We utilized the NAPSIG symbology for the risk index, which was recommended for layers pertaining to disaster response based off of input from FEMA. The Wildland Fire Health Risk Index was utilized by Skymantics as an input into their wildland fire evacuation workflow. Additionally, we worked with Skymantics to utilize synthetic population modeling to predict the prevalence of chronic health conditions to the census tract administrative level. The Wildland Fire Health Risk Index is calculated through a weighted combination of the health and social characteristics of the impacted population. The risk index identifies populations at higher risk of adverse health outcomes in, or those with chronic conditions that are exacerbated by, a wildland fire scenario. The data for these factors was sourced from the U.S. Census Bureau, the U.S. Centers for Disease Control and Prevention, USGS, CompuSol, and Skymantics. The primary standards utilized for the Wildland Fire Health Risk Index include WMS, WFS, OGC Features API, ISO 3116-2, GeoJSON, GeoParquet, and Cloud Optimized GeoTIFF. During this pilot, we began researching standards relevant to the data utilized, including ISO 3116-2, ISO TC 215 Health Informatics, and HL7. Future pilot efforts should continue to explore standards related to health and demographic data and data exchange. The Wildland Fire Health Risk Index is published on HSR.health's OpenGeoMD platform, which is deployed in the AWS cloud through both an Esri ArcGIS Enterprise stack and GeoNode and GeoServer open source stack, as well as through other catalogs made available through the pilot. Each of the layers for the Wildland Fire Health Risk Index that are available in the OpenGeoMD platform can be imported into a user's own system through a WMS GET request via a link in the top right. Additionally, the data is made available through an OGC API instance as shown here. The Wildland Fire Health Risk Index will remain available on the OpenGeoMD platform as a persistent demonstrator. To expand upon the capabilities of the Health Risk Index, it will be incorporated into our generative AI-based GeoAI for Health platform that also incorporates a decision support AI based on a large language model to provide real-time guidance and supplementary information to emergency response personnel to aid in responding to the impacted populations in such a dynamic scenario. In future climate and disaster-related OGC pilots, the capabilities of the indicator can be expanded through incorporating climate models and additional synthetic population modeling to predict the health impacts and severity for future wildland fires in the western U.S. Additionally, we can demonstrate interoperability through ingesting the outputs from fellow participants in this disasters pilot to enhance the capabilities of the Wildland Fire Health Risk Index. Thank you very much for watching this demo. For additional information, please visit our website or contact us at impact@hsr.health.